Stephanie, ready?
Yes.
Okay. I'll start with the flag salute.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Well, welcome to Shawnee County Board of Commissioners work session. It's Monday, December 11th, 2023. On my left is Commissioner Aaron Mays, who represents District 3. My right is Commissioner Kevin Cook, who represents District 2. I'm Bill Rippon, I represent District 1. And Rich Eckert, our county councilors. All right. First on the agenda, Bill, you're on.
There you go, sir. Thank you. Many thanks, Chairman, members of the commission. Mr. Eckert, I think it's my first report with you behind the bench. Welcome, congratulations. I better be fast. That's what they keep telling me. I want to say congratulations to Jennifer, and so, yeah. Had a nice visit with Betty at the get-together over there, the WTW, so I know she got some great plans, and if she was here this morning, I'd tell her how much we appreciate everything she's done to support mental health in Shawnee County, making Vallejo and making us feel like part of the county family. So we appreciate every one of you for making us feel right at home. Wanted to I distributed some materials there at your workstations. Just wanted to check in and make what you could loosely call a quarterly report. I don't quite get here. I think I get here quarterly, but not like on the quarter, just the way our financial reports fall on the calendar and so forth. And I want to be sure and get in before the end of the year, hit a few high points, what we're up to, take your questions, suggestions, anything you want to look forward to in 24, 25, 2030, you know, if the board will keep me around, whatever kind of long-range planning you want to do. So we're here to serve, and it's a pleasure. Did bring in the financial statement for your review. And so if you could kind of magically take out depreciation, we'd be about holding our own. Of course, with a nonprofit, depreciation's kind of an accounting thing that we have to do and gives us an idea what our liability is, but it's not cash out the door. So the fact that Medicaid started paying us at cost on July 1 for the first time ever, really, has made a big difference in our funding. Things are starting to balance out. I think the way we run our calculations, we're within about 1 day of revenues matching expenses. So our expenses are about 1 day's operations, about 70,000 or so over. So you won't see that on that report. You've got to take out depreciation and do a couple other little things to get a cash operating picture. But we are holding our own, and I think we're hanging on right now to about 3 months reserves, maybe 3.5. We try to keep at least 4, 4.5, or 5, but we just haven't been able to do that in the last couple of years, like a lot of entities, governmental and non-governmental and nonprofit, just trying to keep up with, you know, pay and benefits. So we spend a lot of money trying to keep our staff on board and recruit people, and been pretty successful at it. We've dropped our vacancy rate from 17 or 18% earlier this year. Seems like we had about 68 open positions out of 350, whatever that math is. We're down to about 30 job openings right now out of 350. So it's about a 9, 10, 11% vacancy rate. Problem with that is most of those open positions are for shift work in our crisis program or in a couple of other places where we need people overnight, but we are trying. So anyway, there's our financial statement. Be glad to answer any and all questions. Our audits for 2022 have been completed, and we've handed those over to the financial administrator's office. Our audit for 2023 will probably be done in about July. We'll get that down to you just as soon as it's done. So good news is we're holding our own. Our grant funds, including our county funds, for which we're very grateful, are holding up. So if we can, in general, keep our standard grant funds from city, county, state, and federal where they are, or even improve. Now that Medicaid is paying at cost, we're not dipping into grants anymore to pay for serving Medicaid people. The Medicaid companies are paying that. So if the formula continues to hold on, I see us improving month by month, year by year as the years come on. So we are provisionally licensed, certified as a certified community behavioral health clinic. That's a federal and state designation that once we meet certain standards, and we've met those provisionally, Medicaid will pay us at cost. They pay a daily rate. So if Joe comes in at 8 o'clock on Monday morning and he has Medicaid, we get paid for taking care of him for 15 minutes or 23 hours and 59 minutes. If he comes back on Friday, we get paid for the day. So that's kind of how that works. It's a pretty complicated cost formula that we and the other mental health centers are going through. And I'll pause for questions anytime you have them. I'll try to make it brief, though. I guess you don't have a big agenda. I either get like 2 or 3 hours or 2 or 3 minutes. I'll take whatever you want to give me. Just some data for you to review there at the third quarter. Try to get people in right away. We are something like 96 or 97% of the people who walk in Monday through Friday between 8 and 5, well, 8 and 3 really, who are not in crisis are seen the same day. They don't have to come back the next day. So if people are in crisis, they get seen like right away. Those appointments generally are happening within about 15 minutes of people walking in or sooner. And that's true after hours, 2 o'clock in the morning. We get where people are in front of a licensed therapist within about 12, 15 minutes. So keeping up a pretty good record there. Having said that, it is tough to find licensed therapists these days. Our outpatient counseling department, that group of people who have master's degree in psychology, social work, family, we have 10 or 11 of those folks full-time. They're full. And so as soon as those caseloads fill up, we have to hire someone else. Why it's kind of a tough road to hoe, but we're keeping up some. Might just highlight some of the partnerships there for you. The Intersection Coalition that we put together about 2.5 years ago, work on that intersection between the legal system, the whole of the justice system, and mental health. We've doing some projects there. We've got our extreme weather work group at work, trying to prepare for really bad winter weather, which hopefully we don't get. I'm not a fan of winter, but we do want to make sure that our various agencies are pulling together to help people who are homeless and unsheltered prepare for temperatures, at 0 or wind chills minus 10, 15 degrees like we have in past years. The Intersection to Care program at the jail, where we have a full-time caseworker to help women who've been trafficked or at risk of trafficking, is going pretty well. So I wanted to come in and touch on a few things. Director Cole and I kind of follow his lead whenever I can. He's generally out front on things. He's been talking about a concept called reentry from the jail to the community, which is more than a concept. It's a practice. Armor and the county staff of the jail do a lot of reentry work. But we are talking about, would it be possible over time to develop a kind of a one-stop shop, a place where people could come as they're leaving jail, an actual physical facility, or people from the community who, maybe looking at, if you want to use that term, reentry in a broader scope, kind of re-entering society, if you will. Can we put together a collection of agencies, Monday through Friday, if you will, as many hours as we can, people can just walk in and get services, not like, hey, not like a little convention, not like a brochure and a candy bar, but I mean actually really get enrolled in services that they might need to, help find a place to live, help find a job, get some health care, go to detox, whatever a person might need. So can we create a place operated by multiple agencies in real time where people can just walk in and get the services they need, open up the computer, get them enrolled in mental health, get them connected to the city's EAS, their Equity Access Program. Can we do that? So Brian and I and the Intersection Coalition that we put together, broad-based group of Topeka and Shawnee County folks, talking about, can we do some planning on for some kind of reentry, some kind of one-stop social health, behavioral health, family kind of center. So just a few things we're involved with. I'll pause there and I don't need to introduce Linda. You all know Linda, who serves faithfully on our board, and just a great volunteer. So I'd stand back if Linda wants to make comments or you have questions. Our time is yours.
Mr. Chairman?
Yes.
Bill, can
Yes,
you talk to us a little bit this morning? This would be a great time to talk as a work session about the competency stand trial work group or CST, as it's known by its initials, For my fellow commissioners, if a person is accused of a crime and a court has an evaluation that determines the person is not competent to stand trial because of mental issues, they are to go to a mental health facility and given treatment until either such time as there's a determination that they can't be competent or they are determined to be competent and brought back for trial. And in Kansas, one of our issues is we find that the waiting list to go to Larned is between 3 months at a short to 8 months to a year on the long end, and they're being held at the Shawnee County Jail. We did have legislation passed that we are compensated now for that
Right.
time that they're waiting. But I know that Bill has been working with a number of individuals in the community about how can we maybe step that up, or how can we address that delay? And Bill, I'll turn it over to you.
A great introduction, Commissioner. Thank you. And thank you for your support, by the way. You've been to the intersection meetings. You've helped out and contributed. So this work, competency to stand trials based on, is it 3302 and 3303 in the statute, pretty clear cut. And traditionally, mental health centers across the state have been available to do the evaluation piece. So you sit down with an individual, you can pretty quickly, through some predetermined measures and some training, determine who's pretty much competent to proceed on to trial and who is not. And so the evaluation is an hour and a half, couple hours worth of work. We don't do those currently at Vallejo. Dr. Blakely is doing those at the jail, and he does a great job. And our staff are trained and ready to go as his work schedule kind of, goes down, as I think he's maybe looking at stepping back and pulling back a little bit. So we're prepared to do the evaluations. The tougher work is the restoration. Take an individual who's been determined not competent or incompetent to stand trial. How do you restore that individual long enough to competency that they can actually, they understand the role of the judge, they understand the role of the prosecutor, defense, they understand the charges against them, they understand their rights, they can basically converse and understand those things. Often what gets in the way of that is a brain injury, some other kind of cognitive limitation, or a mental disease like bipolar illness or schizophrenia, some other forms of really severe mental illness can interfere with a person's capacity to understand the charges against them, the consequences that may be there, the presumption of innocence, and so things like. So the tougher work is doing that restoration, which might take an hour, or it might take 10 or 15 or 20 hours, might even take some medication. Those have traditionally been done pretty much at Larned State Hospital, and they, like everybody else, have a hard time hiring staff, and that's pretty much the delay there. They only have a certain number of beds that they can staff at any given time. So the mental health centers in several areas are looking at, or other providers, can we do restorations in the county jail? They're called community-based. And the answer is yes. I think 3303 was revised to allow that kind of work. There's payment for it. We can be compensated for our time, so that doesn't fall back on the county so much. And so we have put together a work group that's focusing on implementing that, led by Tim Phelps. And Judge Wright is pretty much involved in some of the, so we've gotten some court orders from the state hospital, how to write those, how to do this, how to do that. I think everybody's pretty much up to speed. The issue that we're running into is that if an individual is mentally ill and in jail and found to be incompetent, if they don't agree voluntarily to go through competency restoration, which could be an hour, could be 10 hours, could be 10 weeks, and the only thing standing in their way is psychiatric medication, like an antipsychotic drug, and the individual does not consent to take that drug, then you have to compel them. You have to mandate that. It's called medication over objection, forced meds. We haven't quite figured out how to do that yet. The jail is willing, everybody's willing. There's just a couple of technical things that we're going to be having a meeting with the Deputy Secretary of KDAS to figure out how to do that. So I think it's a matter of wording a court order just right. It's some legal stuff that's way above my pay grade, but we've got the right parties sitting down and visiting about how to do that. So we will, I think, figure that out and be able to proceed. But the capacity is there to do that work locally, saves travel time with jail and law enforcement staff. It speeds up the process of due process and justice. It's just a win for everybody. It's cheaper, to do it at home than to go to Larned. Commissioner, have I left out any high points?
That factors into our expansion of the
Oh,
Shawnee County
perfectly.
Department of Corrections
Yeah.
with a expansion of the mental health facility.
Right. Great strategic move there, by the way. Vallejo's a part of that. One of our key partnerships, other than Rescue Mission, Health Department, some of the others would be the County Correctional Facility, and we look forward to that someday. In fact, we've had conversations, although, it's just conversation at this point. So, it'd be great to have a reentry center somewhere near there, where we could almost right away just have folks go, if they want to the reentry center and get those services on their way out of corrections, back to the community. The whole idea is to wrap some protective factors around those individuals of one kind or another. But yeah, it's a great, it'd be a great place to, a facility like that would provide a good opportunity to interact with people, do the competency work, the restoration work, have the classrooms. And although you can do the restoration work one-on-one, it doesn't have to be a group of people all going through the same thing. It's a highly individualized process. But we sure look forward to enhancements in the correctional system, and just want to make sure that we're doing everything we can for, Vallejo to be a constructive part of that. So.
Fentanyl seems to be a thing that a lot of people talk about
Yeah.
in the news or in political office, but as our actual person who has the work that's being done in the community, what do you see as it relates to fentanyl?
Well, and I want to give credit to PARS, Topeka, to Mandy Chikansky and her group are doing some great data gathering and analysis and planning. They've held some learning sessions and workshops, have invited some law enforcement agencies in to discuss all that. We're starting to see the fentanyl pop up more and more. It's appearing mixed in with a lot of drugs. We've even heard about it being mixed in with commercial cigarettes. And so the scary thing about that, and if you haven't seen somebody revived, using the Narcan, which is a remarkable thing to see. I happened to witness one day. It's a scary, scary thing. It's kind of an invisible, drug that could be passed on to people, especially our young people, unsuspectingly. So we are seeing a rise in that in terms of people who are admitted for detox and treatment at Vallejo's alcohol and drug abuse program. I think our other partners, Mirror and some of the others, are seeing the same thing. That, along with the methamphetamine addiction, which, that's, you all probably know this, that drug just grabs a hold of you within a couple of 3 uses. I mean, it can start to determine everything you do in your life. So we see those as a couple of major challenges out there. In fact, it's kind of the basis on which we'll soon be proposing a use of the opioid funds that the county's been in receipt of and the city's been in receipt of. We've got a document that we've forwarded on, and folks are taking a look at that, but we'll want to hopefully soon stand up and make a presentation for those dollars, and have recently sent that to counselor's office as well to look at. So got some ideas there about how to put those dollars to work with our partners, Family Service and Guidance and PARS Topeka. But so, Commissioner, have I left any high points out or
No,
answered?
I think.
Yeah, but the fentanyl is on the rise. It's a scary thing. It's invisible. I mean, just the tiniest amount can, really create an immediate health problem. I think the first responders around the city and the county are geared up. I think most of them are trained. The Narcan's available. We have some in stock at the Mental Health Center. It's readily available if we need it. And so I think we're making about as much progress as we can at this point, so.
Bill, your extreme weather work group, what does that look like? What do they do?
We formed that with our partners, the Rescue Mission and Topeka Police Department. I'm not sure anybody from the county sheriff's office attends. I haven't looked at the membership list for about 2 weeks. So it is the Mental Health Center, it's a Rescue Mission, TPD, several other agencies. We are on standby during the summer and winter. So in April and May, we're starting to say, okay, when it gets to be 105, 110 with oppressive humidity, what can we do to create some places where people can cool off? So as winter approaches and temperatures will start to plummet to 5 degrees, 10 degrees, wind chills 10, 15, 20 below, what can we do collectively to protect people and get them off the ground into warming centers? So it was we formed this group about 2.5 years ago, and have done a couple of things, have responded. We are looking now at various warming centers around the city where people can go for a few hours or overnight or a day or two if they need to. So, for example, at our crisis center at 400 Southwest Oakley, if somebody shows up there at the front door and it's 15 degrees below, I'll just pull a number out, and they're not prepared for it, and they want to come inside, even if they don't really meet the admission criteria, we have a group room. We can put them in. They could stay for a few hours. They could sleep there if they need be. We can get some food into them. If they want to be evaluated, we can do that to see if they're having a personal crisis. But we're just opening our doors. Breakthrough House over here at 12th, or the old Social Security building south of the Justice Center. They opened up the last couple of years, just opened up their lobby during the day for anybody to come in and get warm. So Rescue Mission has done that. In fact, last year, I think it was December 23rd, I got a text from the then city manager, hey, Bill, you know, it's getting ready to be really nasty out. What can we do to get people off the street and get them warm? And so I reached out to the rescue mission. They were formulating some plans. We all got together and opened up and I have to tell you, rescue mission carried about 85% of the water on that, maybe 90%. But they opened up like a 3 or 4 day warming center at one of their storage facility just north of the river over there. And I think we brought in 55 or 60 people. We had firemen come and volunteer their time, county people and city people. Mental health center had a couple, 3 people there. I did a shift early one morning, and gosh, we got a bunch of people off the river, you know, off the streets and into a warm until the weather got back into the 20s or 30s, stuff that's halfway tolerable. The other piece that surrounds that is that we're all the time looking for ways to help people who are homeless and unsheltered with a hand up. We don't really believe in handouts, but if we can give somebody a hand up, something that will improve their life or open the door where they could get some help with a housing voucher, you know, crisis care, detox, social services, family reunification, whatever it takes. We just do a bunch of things to get in their way. So that's kind of the idea of a warming center. Can we do something to help you out when it's really, really cold outside, or a cooling center, as the case may be in the summer? But we're all the time trying to help people with, can we give you something to get you up off the ground, like a pallet for like a wood pallet for your tent? Can we help you with an extra tent cover, so when it's, you know, 30 outside and, you know, the wind's howling, can we at least get you some extra top cover for your tent? How about food and water and, you know, that kind of thing? So we're just trying to look for ways to sustain people until such time as they can or decide to not camp full time. So we've got the city divided up into sectors between us and the police and the rescue mission. And the rescue mission, again, carrying a lot of water on that. We go around checking on people, talking to people. What do you need? How's it going? You know, if you need some help, come and see us, or we'll come see you. So we know people. They know who we are. They can count on us. We have the MAP program. But we're all the time looking for ways to increase the safety of people who have to or who choose to live outside, and doing whatever we can just to bring them indoors temporarily or permanently. I'm spending about, along with some other folks, city and county, some other folks, spending 10, 12 hours a week working on the city's task force to try to come up with some recommendations on what we can do, you know, to help people who are homeless, bring them off the street. Can we help resolve the city and the county's homelessness problem, like a lot of other communities are wrestling with, Tacoma, Reno, places like that. So Lawrence, matter of fact. So forgot what the question was that spurred all that, but Chairman, I think that came from you. But that's our, again, just, you know, at Vallejo, we've worked pretty hard to take our whole strategic plan and align about 90% of it with the needs and the problems and the issues facing people in city, county, state, federal government. So just trying to connect ourselves to things that are important to you guys. It's important to us, important to the taxpayers. So helping people who are homeless, trying to help resolve that situation is kind of a big deal for us. And we really rely on our big partners there, the Rescue Mission, the TPD, and County Sheriff, and others are helping out. So, Betty, I don't think you were here when I said thank you for making me and Vallejo feel part of the county's family these last 8 years. We wish you well. You've been a champion for our cause. Thank you.
Yes.
So, Bill, I know that other states have been really pushing for, you know, mental health conservatorship of schizophrenic homeless people in particular. or people who are on the verge of homelessness that are schizophrenic. Have we seen any of that happening here in Kansas, or, I mean, is that something that there are people advocating for?
Commissioner, I'm not aware of any specific effort. I can tell you that the Kansas Guardianship Program is overwhelmed with applicants and not enough guardians available. And those guardians who do sign up are pretty swamped with work, but we do count on them every day to help, pay the bills, monitor people's money and that kind of thing. But, I'm not aware of any specific expansion of the conservatorship program. Of course, that being just a step down from guardianship, the way I understand it. But I hope that answers your question. I haven't seen or heard a lot about that, but if you hear things like that, please let me know. If we can contribute in some way, we sure would.
Okay, and then, of our homeless population, I mean, what percentage would you say are there because of mental illness versus, substance addictions and things like that?
Or lifestyle.
Yeah,
For some,
or
it's
some
choice.
people choose
yeah.
to be, and some people are down on their luck, I get
Down on
that,
their
but
luck,
like,
yeah.
there's some people that, could be helped.
Yeah, yeah. The rescue mission has done a couple of pretty extensive surveys, and I would defer to them, but I can tell you, one thing they have found is that many of the people consider themselves Topekans or Shawnee County. It's like, were you born here? Were you raised here? How long have you lived here? 15, 20, 30 years. And so, and some do come from other places regionally, statewide and nationally, but we have come to learn in the last 8, 10 months, a lot of these are local folks. They're our friends, our neighbors, our family members. We know that that group of people is aging. It's not uncommon to see people my age. I'm 68. It's not uncommon to see people my age living outdoors full-time for one reason or another. And more people living in abandoned structures, old campers without any kind of, or maybe the best you do is a 20 amp running from some house down the street that gives you at least, a space heater kind of thing. So, people that will find an abandoned structure, and because they're used to camping outside, the only source of heat, they'll build a fire inside of it. It's created some hazards and things like that. So, but I would tell you from my experience, I think a lot of our staff would agree, and I think a lot of our law enforcement partners would tell you that a lot, some of it, I don't know what percent, but a great deal is driven by alcohol and drug abuse addiction, particularly the methamphetamine. Like I say, that drug just drives every motivation a person has once they're addicted to it. It doesn't take long, it doesn't take much. Mental illness is another part of it. I know just some people down on their luck, starting to see a few more families that have lost, a mother with kids, dependent kids, and I don't know what that number is. I'm not sure it's droves of people, but we're starting to see some of that and hear some about that. And you've got another level of what you might call homelessness, of kids who don't have a house. They go from couch to couch, day to day, a couple weeks here, a couple weeks there, not really what you'd call a home. And those are probably the lucky ones who are living in a minivan, somewhere. And so we're starting to see some increase in that. But I would tell you that, some majority of individuals who are homeless because of an addiction or mental illness. And again, if we can take a service out to the street and get in that person's way and try to intervene, then we're trying to do it along with our partners. It's a, just informally, just person to person speaking, if we could just magically see the methamphetamine problem go away, I think we'd see a great change in the homelessness population and our public safety and things like that. And I'm trying to indict people who are addicted. That's my whole career, trying to help them, and those are my staff and others. But it does drive, people to make some pretty extreme decisions in their life, and we just try to help any way we can. So, behavioral health issues are a large part of it. That's the most succinct answer I can give you.
Well, so with with meth, it seems like we've done a lot of things over the years to try and mitigate that, with the controlling the ephedrine purchases and things like that. And has it made a difference at all? Or Where's this stuff, is it coming from Mexico?
That's,
Like,
that's,
with-
that's what I hear. I think law enforcement partners would tell you it's coming from somewhere. I'm not sure how much of it's made locally.
Yeah.
And, I think it's affordable. I don't know prices or quantities. I mean, I wouldn't know the literal a lot if I saw it. I'm not that much of an expert, but, I think it's highly addictive. It's affordable. It's probably pretty good stuff in terms of the quality. That's about all I know about it. I think it's something that poses a public safety threat, you know, to our law enforcement, our first responders, and certainly to the people who find themselves addicted in a really bad way. You know, there's times when you really need help. You know, that particular drug can just sometimes make you impervious to the heat and the cold. You know, of course, till you come down off of it, you know, and then you're vulnerable again. But it can just rule one's life, you know, rule it every day.
Where do the homeless people get money to buy drugs? I mean, anywhere they can, any way they can?
I would think so, you know. I don't know.
Bill, from your perspective, and we've been talking about addiction and counseling and treatment, and part of that is people that are willing to make a change or wanting to make a change. Do you see that we have enough space right now at your current facility to address that, or should we be looking at more facilities in different parts of Topeka to really adequately address that?
You know, I know we have talked at Vallejo at the board level about, you know, facilities more in the dynamic core, maybe east and or north of here. At our current alcohol and drug facility, we could expand if we could build, you know, some more detox and treatment beds would be helpful. In fact, it's one of the uses of the opioid funds. If we can, you know, contract with the city and or the county to use some of those one-time dollars, I think a capital expense might be a good use of one-time funds. We could expand detox services. There are some programs that we have in mind that we've talked to some people about. The Intersection Coalition, for example, there's a project called Lead Law Enforcement. I'll think of it. It's an on-the-street kind of law enforcement diversion program that you can implement. It's kind of a model that's been used statewide. So some things we'd like to do upstream, like some early intervention, you know, get to people while we still can, you know, before they're convicted and put in jail. But more detox beds would be helpful. We've tried to learn a little bit about a program called a sobering bed, which is kind of a step down from detox that's being successfully employed in Sedgwick County. So I think there's some things we could do. Commissioner, a little earlier intervention might make a little bit more difference. You know, more counseling staff, better pay for our detox staff so we can keep that program fully staffed. There's some things that we can do. I know that, you know, PARS has some things in mind in terms of increased training and awareness for law enforcement and our community. That's kind of their expertise in prevention. So, you know, we think there's some extra things we can do. How big a dent it'll make, it just have to tell over time. I think any dollars that we might propose to spend, both current funds like from the city and others, you know, our detox funds, we just want to make sure we use those in ways that are proven and established kind of programs that are evidence-based, or at least, you know, other areas are using these programs successfully. But it's going to be hard to tell right away if there's an effect or not. I think if we can intervene with people early when they're vulnerable and get them into treatment, I think we can make a difference. But we're a little limited now with personnel and space and, of course, money. I didn't come here today to ask for money, but
No.
you asked. And so you know, just like the jails looking at expanding their behavioral health facility, we're doing the same thing here. And there have been a number of social and policy factors kind of led us to the place we're at. You know, housing is hard to come by. Until the last few years, we have not had a good housing policy for people who are mentally ill. KDAD's, Commissioner Brown in particular, has led the way to improve housing for people. You know, there have been jail and correctional reforms, you know, where people were, you know, maybe we're using jails more often than we are now in the past, and now we're not. And it's, you know, a lot of social trends there, not to mention, you know, the economy. Back to your question, Chairman, some people who are find themselves unsheltered and homeless or living in abandoned structures do have some source of income. Family helps out, we know, with some folks. Some have, you know, maybe a psychiatric disability or a physical disability, so they do have some support there. A lot of our clients at Vallejo live on $1,100-1,200 a month, disability and whatever family support they can get. So there are various means of support that people have. Some may not be the smartest choices people make, but some do have some means of support. Yeah. Bless you. So we do have some ideas in mind for our current programs, any future programs, and as the funding continues to improve, particularly with Medicaid, our capacity to do things and to take some one-time dollars and turn those into something meaningful and lasting is increasing. But Commissioner, to your point, somewhere in the dynamic core, east of here, north of here, where we find our more vulnerable populations is probably where Vallejo needs to go. Now, we're there all the time in people's houses or on street corners, working with our partners, things like that. But, in terms of facility, I would like to have at least an outreach office, somewhere at least in the dynamic core. We have looked at some places and have studied that some at the board and the executive level, so.
Bill, with your suicide prevention coalition, are you seeing any trends? Are you seeing more people, or is it
So
leveled off?
the number of active clients at Vallejo always hangs around about 6,500 people at any given time, but we are seeing more traffic in our crisis clinic and more acute stories, people coming in with worse kinds of problems than they have. And quite a bit more demand for medication and prescribing. More people having trouble with rent and groceries, so we try to help out there with our crisis fund. So that's the kind of increase that we've seen. The alcohol and drug abuse detox and the 28-day, the demand for that program is back to where it was, and then some, pre-COVID, and so quite a bit of demand there. So that answers your question or not, but an increase in foot traffic for crisis care, number of people walking in, that kind of thing, so.
Any other questions?
No.
Bill,
Appreciate your time.
Tapped out here, so.
That's it. Well, thanks for, letting me, be a part of letting us be a part of the family and hearing our reports and learning everything you can. We appreciate you.
Thank you for coming in, Linda. Thanks for coming, dropping by. It was good to see you.
Yeah.
Thank you for everything you do.
Take care and happy holidays to everybody.
Yeah, you too.
All right. Now I'm gonna move down to public comment. Do we have anyone who wants to speak at this time? No one signed up, all right. Administrative communication? The administrators have nothing to say, all right, okay. Well, with that, I guess we're adjourned. Thank you very much.